Good morning, good morning, good morning. If you're tuning in to Mobility Magic Live on a Monday, 11:30, welcome. We have a double helping of Mobility Magic for you this week. As I'm away next Monday, you have me at 11:30 this Thursday again, so a double helping again. I'm subbing for one of my colleagues on Thursday, and you'll have a double helping this week, and I'll be away next week. So just to let you know up front, if you were tuning in, that is the case for next week. So if you're tuning in today, hello to you in Kitchener. If you're tuning in today, welcome. As I say, we're going to do a little bit of upper body work. We're going to work on some shoulders and try and get this mobilized, and then we're going to do a little bit more kind of mid and lower body on Thursday. If we could turn the comments off, that'd be great. And just so I don't get too distracted. Although you are welcome to leave comments and insults and suggestions in the comments of the video we post afterwards. So let's do our first check-in. We're going to check in, as I say, we're doing upper body rotations to start. We want to do a check-in just to see if the mobility that we do improves our range of motion. That's the most important thing. So it's also going to help understand whether this particular video is of use to you as well, and the movements within it. So we're going to start with a little bit of backwards rolls just to check in, and if there's any clunks and clicks and if there's any discomfort, we want to be aware of that, and we always want to make sure that we're checking in first, making sure that there's something we can come back to see if the mobility is good. So I've done a little bit of a small shoulder roll. Let's move to a bigger one. This can be used as a good dynamic warm-up as well if you were starting something kind of explosive, or if you're doing an upper body focused day. We want to make sure that we're working through a full range of motion. Often I find with clients, sometimes it'd be the simplest things. We're getting synovial fluid into the joints, we're getting that joint to glide. So just let's do one arm on the one side and make bigger circles. If we're getting that joint to glide, we're getting to move through the full range, that can often help to improve that mobility. We're looking for those 1% improvements that are really, really going to help us to improve our range of motion. So second thing I'm going to get you to grab, I should have mentioned equipment at the start, but we're going to use a few things. So if you have a broom lying around, this can be really helpful. If you've watched one of the sessions before, this is a broom handle, or if you have a PVC pipe or something similar, or a dowel, these can be really useful for a couple of different things. So the first thing I'm going to use it for today is we're going to do a little bit of shoulder break. So if I turn to my side, just imagine I get a little bit stuck here. We're just going to try to ease the shoulders back. So ideally, we want to be able to bring it all the way through the range, but I fully appreciate that a number of people that are watching this don't quite have that range yet. So we're just going to rotate our shoulders to the point where we feel a little bit of tension in the chest. If it's before your head, that's completely fine. If it's just past, that's okay too. You just want to hang out in that position and let those shoulders kind of stretch and that chest can stretch off too. So the next thing is to reach up as high as you can. Reach up, stretch your body, try and get those shoulders to open up. We're stretching up, and then we're just reaching back just a little bit, just to ease that. Now, bring it forward and then back, and start to see if this starts to help in opening up your shoulders. We don't need to go full range and dislocation on day one. These are called shoulder breakers, but this is not exactly what we want to do. We want to ease into it. So again, ease into that range, ease into that range. Now you can also lean to the side a little bit, pushing up to get a bit of a lateral stretch in there. And you might also find that helps to open up that shoulder. You can turn your body too if you want to, and then you can lean the other way and lean your body as well. So the idea here is we're just using this guide to help us stretch the shoulder a little bit, or just to check in to see how the mobility is. So we're going to come down to the floor. We're going to start with a little bit of shoulder rotations in a loaded position. Can also help with anything quadruped position, or if you're loading your shoulder from floor, such as a push-up. So shoulder rotations first. We're going to load our body in a quadruped position. As I said, we're stacking our elbows and shoulders over our hands, and we're just going to start to roll our shoulders up and down. It takes a little bit of practice, but if you imagine you're dropping your chest to the floor, rolling your shoulders forward, and then we kind of get into the angry cat position that we often use in kind of setting up our position. So you can go forwards. Again, try to keep your shoulders stacked. We're moving our T-spine a little bit. We can come up and down, and then we can go back. The end position is with our shoulder blades slightly pinching in and then retracting. So we're retracting, we're squeezing together, we're protracting, retracting, protracting, and then if we can get it somewhere slightly in the middle, we can rock back, we can walk our hands out, and we get a little bit of a mid-back stretch. And we're going to move on to a little bit of foam rolling in a second, but this is always nice just to help open up that T-spine a little bit more. Nice deep breath in, breath out. Walk the hands forward and just push down as hard as you can with your hands in kind of a diamond shape, just to help open up that T-spine. We're going to rock back again. We're going to walk our hands round to that left side, so closest to you. And we're going to walk it round to the right side. And again, you do this a few times. I'm just going to do it once or twice. Just kind of help open up my mid-back. And I can rotate as well. I'm going to shift my hips from side to side to help open up my back. And again, I'm just crawling across the other side. I'm just doing it 2 times, but you can do it as many times as you need. And if you watch it on the replay, feel free to pause and do this one before you move on. So next thing you're going to need is your foam roller. So if you have a long foam roller or a short foam roller, it doesn't really matter. We're actually going to do it lengthways across the back, just the T-spine. So idea with this is we're opening up the T-spine, starting off just below where the rib cage finishes, so just below the bottom rib. That's probably where you want to finish. We will start kind of halfway up the back and move up and down, just at freeze of demonstration. So just going to start about halfway up, as I said. Arms going to be reaching up to the sky. You can use your hips to lift up, to drop down, to add pressure, or to relieve it. You can also support your head if you need to, or you can cross your arms if you want to as well. But just to show you kind of a safe variation to support your neck, we're just going to lift our hips up, and we're just going to move backwards and forwards, just a little bit, just to find out if there's any tenderness in the back. You can then kind of bring your elbows in to open up your mid-back, and then we can just kind of crunch forward and back just to lever and to help mobilize that T-spine. So a couple of options when it comes to opening up T-spine. You can do slightly longer rolls between the mid-back and where the thoracic spine finishes, which is about where the rib cage ends. Or you can do small rolls and rocks from side to side, just to help tease open that space in between the vertebrae and just kind of help you get that 1% improvement. Or you can wrap yourself up nice and tight, and you can then have small crunch type movements in between each vertebrae. I prefer to not roll full length personally, because I find with clients that will often leak into the low back, they'll go a little bit too far with the T-spine, and that's when it becomes an issue. So again, make sure that you're breathing through this. So just to review, so you can understand where I'm coming from with this one, we're starting off about mid thoracic spine, so about chest height, let's say. You can either support your head, or you can cross your arms over, or you can reach up. That often helps to help guide you where you should be in terms of pressure. But for now, let's just wrap our arms. We can do small rolls in between sections of, a couple of vertebrae. And if you're getting clicks and pops, that can be fine. But we're not looking for any major movement. We're just trying to help ease that tension across the thoracic spine and the erectors around that area. Next thing you can do is you can roll from side to side across the foam roller, just climbing up each rung, just trying to get each vertebrae to kind of open up. And as you come down the foam roller, same thing. So hips can come up, we can reach, we can retract our shoulder blades too. So that would be the next option in releasing the vertebrae. So let's just kind of check in, see how that back feels. And if you have any rotational issues, often starting at the thoracic spine can be really, really good, because that's where we want that rotation. We want to be able to rotate our upper body and have that nice stability through the lumbar spine. So next movement, we're going to lay face down on the floor. So I'm going to just move my foam roller so it's a safe distance. We're going to lay face down. Now, you can have your left arm across, we can have our right leg on the floor, and all we're going to do is we're going to slightly turn our body, getting in a position with either this supporting hand, this right hand below, putting pressure into the floor so we can rock onto that arm, or hand above, same thing, just stability. We're adding a little bit of pressure, so we're actually stretching the arm that's on the floor. And the idea here is if you're someone who sleeps on your side, you'll already passively be doing this, so it's probably not worth adding any more stretch. But if you're someone who doesn't and has a little bit of chest and shoulder capsule tightness, this can be really beneficial. We're just putting a little bit of direct pressure down to the ground and into the pec, and we're stretching the shoulder. So you can just breathe in, and we can push down with this hand that's on the floor. This is my left hand, you can probably see on the floor here, and I'm just rotating my body away, using this right hand as a fulcrum, and then I'm just relaxing. I'm going to reach across the floor, push down a little bit to add a little bit more pressure. I'm going to lean away, and then I'm going to push my hands to the ground to get that rotation. And I'm getting a little bit of a stretch through the back side of my shoulder and the shoulder capsule as well. Remember to breathe. And then you're going to breathe out on the turn. So you're going to breathe in, breathe out as you turn your body, pushing into the ground with the left hand. Let's switch sides in a second. I'm going to show you the stretch that we're going to do next on the other side, just so I'm not flipping too much and losing your attention. But we're doing a chest stretch next, so I'm going to switch to my right hand. I'm still face down. I'm going to come into a bad push-up position where I'm actually more parallel with my chest. I'm turning my body away, so excuse my body turn, but it's just best so you can see. So I'm turning my body away, switching the position to a similar position I was in, and I'm doing this sloppy kind of push-up position where I've got my chest on stretch. So this arm is in a loaded position. I've got my shoulders slightly inwardly rotated, which is not what you want for push-up, but for the stretch it will work. And I'm just gonna push myself up and away from my shoulder. And I should feel a nice stretch through the front capsule of my shoulder, and lifting my chest off the floor and away. And then I'm just kind of fanning the same way we would when we do our hip stretches, just to try and get that shoulder to stretch and open up. And if I want to add a little bit more stretch, I can creep my hand away, turn my body, just scanning and fanning, fan to scan, see what's going on. I'm walking my hand away again, pushing my hand into the floor, lifting my chest, walking my hand away, I'm lifting my chest. And I'm just getting a stretch through the front side of the shoulder. So let's switch around, let's do the other side. I'll switch my body around on the floor here. So again, my other hand's gonna come down, rotating through the middle. I've got this left leg on the floor in a 90 degrees, and I've got this hand either above or below, just to support. So I'm turning my body away and pushing my hand into the floor. I'm trying to get my weight into my shoulder just a little bit. Now again, if you have any shoulder issues, if you're someone who already has issues with lying on the side for sleep, this may not be the one for you. You'll only be doing this passively, but for anyone else who has potential tightness in the posterior shoulder capsule, then this can be a good one for you. So pressure is downwards into my shoulder, I'm pushing slightly up, I'm rotating my body, and then I'm pushing down with the hand that's on the floor, so the hand of the arm I want to stretch, and I'm adding a little bit of a rotation into this. Now again, if you're feeling less of a stretch now that we've switched sides, this may not be the side that you need to stretch as much as the other, but we'll do it anyway for those that do need it. This is my right shoulder on the floor. Turning my body away slightly, pushing down to the floor with my right hand, and then my left hand is just adding support, either above or below the shoulder. And as you keep that pressure, you should find two things start to happen. A little bit of a stretch on that posterior side on the deltoid, and also interconnecting musculature there. And you might also find a little bit of a stretch from the pressure in your chest as well. Excellent. Now, if your arm starts to go numb, that is something you want to try and avoid, so don't spend too long down here. But let's switch sides now. And I'm going to stretch my left hand side for my pec. So, sloppy push-up position. I'm turning my body around. I want to have my right leg this time in the opposite direction, so excuse my rudeness on this side. And I'm doing a slight push off the floor to load that pec, and I'm just going to wave, and I'm going to creep my hand away from me as I feel that stretch. I'm going to creep that hand away, feel that stretch. I'm adding a rotation, so I'm turning my body away from you now. A little bit of a rotation, a little bit of a rotation, a little bit of a rotation, and a creep out with the hand, and then kind of a fan to kind of see what's tight and what's not. And if you need any more, you can lift and turn and see if that pec stretch works for you. Okay, so going to move on to a little bit of a bent arm stretch with our hands behind us now. So from that position, we've done a chest stretch, we've done a shoulder rear capsule stretch. We're now going to load the shoulders a little bit with a bent position. So you just want to get your shoulders behind you. This can be a little bit easier for a combination stretch of those two things for anyone that was having issues before. We want to sink ourselves into kind of a, best describe it as a sloppy crab type position, because we're not stabilizing our shoulders in the same way we normally would from this position. We're actually bending our elbows down, and we're just rocking from side to side. So where you'll feel it most is probably the front side, front deltoid, into that kind of bicep tendon groove at the front, a little bit of pec, and we're just kind of rocking from side to side. The idea here is we're trying to get, again, a little bit of front shoulder capsule, a little bit of in between the shoulder blades, a little bit of neck as well sometimes, I find on this one. And you might also get a little stretch through the biceps as well in this position. So we're just rocking from side to side. I'm bending that elbow as I rock from left to right, just bending it, a little bit of a wrist stretch, bending it. There's no weight in my hip, well, my hips are resting on the ground, let's say, and I'm just getting that shoulder to stretch. So again, feel it through the front side of the shoulder. It's a little bit different to some of the ways we've done this before, and it's just opening up that chest, and it's also opening up that shoulder as well. So from left to right. I'm going to show you a couple of different ways of doing this, as I say today, and we're also going to get onto the lacrosse ball in a second. So with that in mind, we're going to grab the lacrosse ball. I'm going to show you a couple of ways of doing this. So the white one is the one I have today, so I apologize if you can't quite see it against the wall in a minute, but I will try my best so that I give you a good description of what we're doing. So we're going to go for the levator scap. Levator scap is the muscle that kind of connects the neck and the shoulder blade. So we're going to go somewhere in between those 2 points. You want the corner of the shoulder blade and the neck. We're going to put a little bit of weight into it by bridging our hips up. And I want you to imagine that you're about an 8 out of 10 or a 7 out of 10 in terms of pressure on this area. So if you can't quite find it, just keep moving your body up until you do. We're going to raise our hand up to the ceiling as far as we need to, and then you're going to sink your body down into that position. And if you need to bridge your hips, that's all good too. So reaching down towards our feet, we're pulling that ball with us as we engage that weight into that area. And we're just trying to imagine we're putting all the pressure into that ball. It can be really uncomfortable sometimes, just make sure it's an 8 out of 10 and not 10 out of 10. And then we're just gonna raise it up to this 90-degree kind of position to the side, and then back down again. We're gonna lift our arm all the way up to the ceiling, and then we're gonna turn our thumb down towards the pocket, and we're gonna do the same thing. So we're kind of gliding through on this one. Again, maintaining the pressure. Best thing you can do is maintain the pressure all the way through. We come down, bring our thumb to the bottom corner. If you can bring it all the way over your head, I can't. I have a wall here, I'm a little bit too far up this way. But again, we're just trying to get as much movement as we can, so we can even internally, externally rotate if that helps you. Again, working on that levator scap area that sits between the shoulder blade and the neck. So, next one I really, really like, and you've seen me do this one before, is top corner. We're going to unsheath the sword, and then we're going to thread it back into the scabbard. So, sheathing the sword in its sheath, bottom corner, thumb goes up to the top corner. We'll bring that shoulder across and reaching for the top corner. So it kind of flows down. Now, we can also move a little bit more centrally. So now the ball is traveling across a little bit more towards the erectors of the middle of the back. I will shuffle down a little bit more so you can see. And then what we'll do is we'll do the other side on the wall. And those that are watching on the replay, you can either pause it, or those who want to do the other side can continue on the floor if that's more useful. Now, the reason I like to do it sometimes on the floor is you can add a little bit more pressure if you have any neck issues. You can kind of raise your hips instead, or if you actually prefer it because you can't quite access the wall or have someone to do it, then the floor works great too. So, making sure that we're tucking our chin, we're going to sink our weight in by lifting our hips up, we're bringing it back, and we're just going to do a full circle around this way and up. So we're stretching up, we're sinking down, coming full circle around and back to the center. Now this time what we're going to do is we're going to reach over to the back wall across our body. We can even help it by just pulling our shoulders slightly as we turn our body towards this side. It can get pretty intense, so just bear in mind that we don't want to bruise ourselves, we're just looking to feel a release and stretch. Now from this position, just to complicate things more, we can actually add a neck stretch in. As long as you're tucking your chin, we can actually sink our chin down, stretch across, and feel that teres minor as well as we kind of roll up a little bit. So now I'm starting to follow the border of that scapula with the ball, just tracing it around, and now I should have the ball just below my shoulder, so I'll turn a little bit so you can see, and it should just be on the outside edge of where the ball sits in the socket, and I'm just going to turn my hips a little bit too. So I'm going to guide you through all this on both sides, as I say, on the wall for the next section. So if you need to pause, if you're on the replay, now's a good time to either skip back to the start and do the other side, or if you're on the follow and you want to stay on the ground, we can do the same things on the wall anyway. So instruction might be different, but it's the kind of same principle. So I'm just going to move over to the wall. Hopefully you can see. I'm going to do my right side this time. So make sure that you're in a semi-squat position, because you can always come higher with the ball. It's just very difficult to get it lower without losing control. And we're going to work across until the ball is in our levator scap. So sitting about there for me, probably a little bit higher actually, probably about there, sorry. And we're going to sink our shoulder down to the floor. So this right side, I'm pulling it down towards the floor. That's just to get my shoulder blade in the right position for this stretch. And I want to make sure that my chin is tucked as well. Really important because, as I say, this muscle attaches the neck and the shoulder blade. So we're sinking down towards the floor. And then we're just working that top corner, the top edge of the scapula, which is rotating around. And if this is the area where you're most tender, this for me is the side I tend to get most tight. It's my dominant hand. Then just hang out a little bit longer, but just make sure that you're not going above an 8 out of 10 in terms of discomfort, because we want to make sure that we're not bruising ourselves, frequency over intensity. So we're going to lift this arm up, and I have a bulkhead here, so I'm just going to try and get as far as I can, lifting up as high as I can, and pulling that shoulder blade down and lifting up and pulling down towards the floor. I'm just rotating that thumb up towards the top corner, across my body as well. You may even find there's a sweet spot where it starts to release really nicely. We're going to do full circles. We did this on the floor if you remember. That full circle motion, try and capture that whole shoulder. And then we're going to pull it across our body just a little bit as we get into that bottom corner of the shoulder. We're just going to tuck our chin a little bit more. Just following that levator scalp across. So it normally sits on that top L corner of the scalp around here. It kind of shoots off towards the neck. So that's kind of where you want to stay if you want to release that area. But if you want to glide across the top of the shoulder blade, that's cool too. You're going to hit that as well. You just want to make sure that you're moving all the way through. So again, a couple of things you can do here. Thumb all the way up, and then we're going to float down with the thumb pointing down to the bottom corner. All the way up, all the way down. We can then go across the body, unsheath the sword, turn our hand up to the ceiling. We can even turn our body all the way out, keeping that pressure on the ball. So we get into this bottom corner of the lat as we turn the other way, and we can even get into kind of the corner of the shoulder. This should sit kind of around where a lot of people tend to say they're tender. We're just going to pull our shoulder blade down to the floor. So this time we're actually more at the, I'm on my right shoulder, so it should be more towards the actual arm itself, more on the edge of the shoulder blade. So we kind of floated across. And this is another addition you can make, which is pulling down to the floor, which is putting pressure down either into the wall or the floor if you're following along. And then we're just going to float back to the middle. So next stretch we're going to do, we're actually going to do a little bit of stability work now. We're going to do a little bit of stretch for the low back. So we're going to lay on the floor. Now if you've done the wall clock before, we've sometimes done it against the wall and you kind of go around. You can also do it that way. There's also a way we can do it on the floor as well, and it works great. And it also helps with the low back stretch too. So I'm just going to find a better space you can see. Now straight leg on the bottom. I'm bringing my other leg across to 90 and I'm just pinning the leg with this arm. And we're going to rotate this arm around. And as soon as you start to feel this arm lift up, so about here I'm tight, and this hip start to lift, this is where I want to take a nice deep breath in. So we're going to take a nice deep breath in. And as I breathe out, I should find the tissue on this side of my body starts to relax a little bit. My arm sinks down to the floor, and my low back starts to open up too. So nice deep breath in. As it starts to relax. On the out breath, just imagine this arm just gliding behind you. And on that out breath, you should find the tissue just starts to relax, and just let that arm kind of glide behind you. Keep this leg down if you can. You should feel a nice low back stretch too. And as you rotate around, you should find that your chest starts to open up just a little bit as you follow that breath. Let's switch sides. I'll try and get the best view for you so you can see. Again, big point with this one is going to be to follow that breath. The out breath is what's most important. As you breathe out, your body will relax as you come across. I'm going to straighten my bottom leg. My hand is going to support this knee so it doesn't kind of lift. This will also help a little bit of a low back stretch as we kind of come around the corner. You can go from behind to front or front to back. It doesn't really matter. The main thing here is you're moving with your breath. And if you really want to, you can support your head if you prefer. If you're finding there's any neck issues, or a yoga brick also helps. So again, we're just starting to help stabilize this shoulder, get some control over it. So nice deep breath in. Starting to get stuck around here, so take a nice deep breath in. So as you start to open up, as you find your body starts to relax in this position, you probably want to do it 2 to 3 times. So just to finish off, we're going to do a little bit of shoulder stability work. We always want to make sure that after we mobilize and move tissue around, and we've got a little bit more range of motion, we're also doing some stability work as well. Now, you can also check in at this point, so feel free to do some shoulder breakers and some rotations, but we're going to finish off with a little bit of stability work now. So shoulders are back. We're in that crab position we were in before, but this time, we're going to pull our hands a little bit close together at the back. I'll turn a little bit so you can see. Pulling our hands close together, we're externally rotating our shoulders. We're trying to squeeze our shoulder blades together here. Our fingers are pointing away from us, and we're just lifting our hips slightly and rocking back onto our hands. So we're pushing actively down to the floor. We're keeping these hips bridged, and then we're dropping the hips down. We're lifting these hips up. We're rocking forward, rocking back. We're rotating our hips slightly. We're just moving our hands backwards and forwards. We're squeezing the shoulder blades together. So rocking back and forwards, rocking back and forwards. If you want to lift up one hand to the other side, if you feel stable, you can do that too. This is only going to add and help with that stability, but just bear in mind that if you're someone who has not done that move before, it can be a little bit of a challenge. So that is all we have time for today, but I am back on Thursday at 11:30. I would love to see you all again then. Just a reminder, there is no mobility magic next Monday. I'm lucky enough I'm away, so hopefully sunny weather. Otherwise, have a great week. I am just going to tell the comments again because I forgot to do that. Have a great week. I will see you all on Thursday again at 11:30. And if you have any questions, anything you'd like us to cover on Thursday, or any feedback, I would love to receive the feedback. You can either message me directly at Fashion Stretch Simon, or you can leave it on the video that we post afterwards. So thanks so much. I will see you all on Thursday. Ciao for now.